Hi, good afternoon, everybody. I'm Jody Hanson, Director of Public Affairs and Communication for Johnson County Government. We have with us today Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is our Director of Epidemiology. And we also have Allison, who is our ASL interpreter today. Thanks to all of you for being here. Dr. Ariola, I know tomorrow is a big day. Our new vaccination clinic site is opening and that you were there this morning. Maybe you could start by telling us how things are going there as we're preparing for our first clinics tomorrow.
Thank you, Jody, and good afternoon, everyone. Yes, we are quite excited about the new location. Obviously, it's something we've been working on for several weeks with facilities and county managers and other partners. We obviously looked at several facilities that meet what we're looking for. We obviously want flexibility. We want to be able to vaccinate for longer hours, after hours, on weekends. We want a place that can accommodate the kind of throughput that we need to get enough vaccines into people's arms every day. And so because of the hard work and the diligence, we're pretty happy that tomorrow we open this new facility. I know there's some last minute activities going on, but just walking through the facility today, looking at the flow from when people come into the building to where we have staffers and volunteers that will assist for those that need assistance with completion of forms or checking in to getting vaccinated and the checkout and where you sit for about 15 minutes before you leave. It's just really good to see how that's developed. And obviously we would take it fairly slow tomorrow to see how things work. I looked at that today and look, it's a good site. It's a good location. Absolutely appreciate the collaboration we've had from the Parks department and Jeff Stewart's team and the support and being able to not just make Okun available to us, but Arts and Heritage and supporting everything we do. Just really, really good to see that we are at this location and the day that we've looked forward to is finally happening tomorrow. I would say for those that are coming to our clinics to understand that for the next couple of weeks, we're still running both the new location in Lenexa as well as Okun. And so if you got your shots 3 weeks ago or 2 weeks ago, we will have told you then that your second shot is due 3 weeks from today or 3 weeks from today. That's what we will say. At the same location at the same time. That still holds true. So if you do your second dose tomorrow, you're going to Okun Field House. Okay. Now, for those that are coming to Lenexa, you will have received the information. You booked that appointment last week. So we want to be sure that you go to the right location and to get your shots. And so for those that we're running through for the maybe just under 700 people, as we make sure that we are working out glitches that may occur or kinks in the process tomorrow. The hours are 9 to 1. We will have provided the information to you as to when you need to be there. So we do need you to show up about 15 minutes before the appointment time. You don't need to come in an hour before then. There's a flow to what we do, and we're trying to run certain number of people through our clinic every 30 minutes, every hour. And so if you show up too early or too late for your appointment, that will disrupt the process. But you know what's even more disruptive of the process is when people show up with that appointment. And so we understand that people want the vaccine. What's been absolutely encouraging and that we really like is the fact that our residents want the vaccine. That's a fantastic thing. But I do want to assure you that we want to give you the vaccine. We are working towards the same goal. Obviously, the challenge is we just don't have enough appointments. We can only do so much based on the number of vaccines and resources that's available. But we also know that our partners are vaccinating. But if you look at our data every week, we're continuing to vaccinate thousands of our residents every week. And so the more that we chip away from that big denominator, the higher your chances of getting called or getting an appointment is. The governor did talk last week, as well as in some communications we have today, that we're expecting even larger number of vaccines to come into the state. And so that should translate to more vaccine coming into the county. And what that really means is we will get more. Other providers in the county will get more. As we've said consistently, our approach is not to give out the vaccines that we have through 2 or 3 locations. We always felt that 20, 25, 30 locations a lot better than 2 or 3. And we have seen the impact on our numbers, but as more vaccines become available, you are going to even continue to see that. Our providers, our partners in this are going to get more vaccine, but they are also vaccinating this week. All of our health systems are vaccinating. KU Med is, Olathe Health is, Advent Health is, St. Luke's is, and I know, and Menora is. So all of those are ongoing, and I need to mention Overland Park Regional too. So there are vaccinations going on. The pharmacists are vaccinating, and if more vaccines come to those and the many other providers that are ready to go that we're just not able to get going because we don't have enough vaccines for them, you can see why the next few weeks we are very optimistic that the number of our residents that we're able to vaccinate weekly is expected to increase. So again, keep that interest up. Thank you for the patience, and we are looking forward to getting more vaccines into your arms. Today, we also moved along with the rest of the state per Governor Kelly's announcement into phases 3 and 4. That should not be interpreted to mean that we don't have persons remaining from phase 2 that needs to be vaccinated. It just means that we'll continue to do those together. And yes, we know that we vaccinated quite a lot in phase 2. Elizabeth is going to come on and talk about the remaining schedule for second doses for our K through 12 and childcare providers. We saw our numbers in the vaccination in the 65 plus group last week clearly have done greater than 2/3 of those. So, and there's so many targeted vaccinations that we've done in phase 2, and we're tracking all of those. Now, there's still some. You're probably listening and say, I'm a grocery store worker. I've not been vaccinated yet. That's okay. When we open up the appointment, book the appointment. But right now, if you qualify for phase 3, 16 to 64, based on medical condition, you can book an appointment. And if you qualify based on the category of where you work outside of the medical condition, then book the appointment. We made an arrangement last week to vaccinate our higher eds through collaboration with our health system. So we're making a lot of those kinds of arrangements that's augmenting the vaccinations that we are conducting in our clinics, that's augmenting the vaccinations that our other providers are providing. I will continue to look at opportunities to do this. So again, we keep up the interest, and the opportunity will be here very soon. And Elizabeth, if you want to talk about K through 12, but also when you are done with that, I'd like for you to get into, because vaccine is one piece of tools. We still need to continue to do the other activities. And right now, there's a lot of people traveling for spring breaks, and there are factors that are involved in terms of ensuring that we don't lose the gains that we have made. So if you would talk about what CDC recommendations are, number one, the primary advice is if you don't have to travel, don't. But if you do, what those recommendations will be.
Absolutely. Thank you, Dr. Ariola. Just to also piggyback and sort of the asks for patients, I know that looking around what other states are doing and even other counties in Kansas, people have expressed frustration that maybe that opportunity doesn't exist here in Johnson County. I've heard from other jurisdictions that people can just walk in and there are plenty of appointments. But really what it comes down to is supply and demand. being in Johnson County, because of our population, we actually, I think, have a higher demand for vaccine. And we're seeing that with the sheer volume of people who keep saying they want doses. And that is incredible. And I think that Dr. Ariel and I couldn't be happier than having a large percentage of our population want the vaccine. Unfortunately, we are a very large population in general compared to the rest of the state. And so the supply doesn't always keep up with that. And so while you may see some other opportunities that exist in maybe more rural parts of Kansas, it's not that we are holding on to vaccine or we're not doing certain things. We are getting vaccines into clinics and vaccinating people as quickly as we're getting it in hand. So we ask for your continued patience. But quite frankly, if you have the means and are able to travel to another jurisdiction in Kansas and get that vaccine, and they're open for that, you are more than welcome to do that. We will get that information from the data that we look at. So when we get to report that, we have 180,000 doses given to Johnson County residents, if you got your dose in Kansas, we will count that towards those numbers. So again, just asking for patience. We are, as soon as those vaccine doses are in our office, we are getting them out the door and into individuals. So we appreciate the interest. We want everybody vaccinated who wants it. So looking forward is hopefully we get more vaccine to be able to do that more quickly. As for childcare and K through 12, which has been this incredible partnership with Children's Mercy that we've had since the beginning of this year, once vaccines started rolling out, is nearing an end. We had about over 15,000 K through 12 educators and childcare providers who were immunized through Children's Mercy clinics. And this weekend, we are finishing up second doses along with our last second dose clinic next Tuesday. So if you are a childcare provider or K through 12 educator at one of our schools, you should have had the opportunity to get that vaccine through your school district or through your childcare provider. And so if you have any questions, please reach out to either your administration or if you're a childcare provider to the Johnson County Childcare Licensing Division. But we're excited to get those individuals vaccinated. And it's just one step closer to being able to ensure that our kids can stay in school, that we can keep school buildings open. Really, when it comes to vaccinating educators and staff members at schools, what that means is that if people get exposed to COVID-19, they won't have to quarantine. They won't have to go home for 8 or 10 days or even 14 days to make sure they don't get sick. They're able to stay in the building, teaching school, teaching classes, driving buses, all of these really important pieces that we need to keep kids in school, to have that sort of continuity of education. And so this is a really huge first step. So we're very excited that after next Tuesday, we should have vaccinated every K through 12 educator and childcare provider who is interested. But to Dr. Ariola's point, our work does not stop here with vaccinations. COVID-19 is still circulating throughout our community as well as the country and the world. In fact, I saw recently that there are now 27 states who are reporting an increase in their COVID-19 cases. And a lot of this is thought to be due to the new variants that are circulating that are more infectious than what we call the wild type virus, or the virus that's been circulating throughout our community since last year. So what this means is, of course, even in Johnson County, if you're going out, please continue to wear your masks and physically distance from people. Try not to gather with individuals outside your household. Now, if you've been vaccinated and you have friends who are vaccinated, that does change a little bit, but we still need to be cautious. We know that this virus can change trajectories very quickly. All it really takes is one weekend of a lot of activities and people not wearing their masks, and we can see incredible spikes, which is really what happened last fall. So if you are going to travel, and again, the recommendation is not to travel if you don't need to, but if you are going to travel, CDC recommends that you get tested upon your return between 3 to 5 days after you arrive back. And during that time, try to stay home and quarantine yourself. And this is, again, to protect people around you, your friends, your family, your coworkers from contracting COVID-19, because you can spread the disease even without symptoms. So if you go travel somewhere, you come back, particularly internationally, the recommendation is to stay home for at least 7 days, get tested between day 3 and 5. And if you're not tested, to stay home for 10 days. And again, this is for international travel in particular. You will be asked to be tested prior to getting on a plane to come back to the United States. So please be aware of all of these different components if you are traveling, and really doing your part to keep your community safe, which is where we all are, right? We're all working on vaccinations. We've all been masked for the last year. So really to protect our community, our loved ones, people who are vulnerable. We still have a number of vulnerable community members who have not been able to be vaccinated yet. So just continue to do the things that you've been hearing us say for the last year. Wash your hands, stay home if you're sick, if you've been exposed, wear your mask, and stay distance as much as possible.
Great. Thanks to both of you for sharing those updates with us today. I'll go ahead and take some questions that have come in. So this one has to do with the fact that we've moved into phase 3 and 4 as of today with the state. So as we enter the next phase of vaccinations, what does that mean and look like in Johnson County? Will it be easier or harder to get the vaccine since more people qualify? Oh, you're on mute, Dr. Ariola.
Oh, wow, I did that again. Excellent question. Moving to phases 3 and 4 does mean that a lot more people qualify. Phase 2 was pretty big, but when you add to what remains of phase 2 to what's now a big group, perhaps bigger than phase 2, it's a lot. It's a big group. However, the difference though is when we started with phase 2, we were not getting a lot of doses. Now, this past couple of weeks, we're now getting almost double what we were getting 5-6 weeks ago in terms of vaccine allocations. And so yes, there are more people, but it's also true that we have more doses coming in. It's also true that since we started with phase 2, now we are having, although small, but doses that are going to our pharmacists through the Federal Pharmacy Retail Program. But it's also true that we expect more doses to come. I think the state's been clear that they expect more vaccine to come into the state on March 29th. That's about a week from today. So more doses are coming in. It's a larger group, but hey, Jody, I love the problem. I want the problem to be I have too much, I have too much doses, too many doses, and who is going to help us give those out? That's a better problem than to have than to not have enough doses when people need them. So it's a challenge that we are thinking through and pulling in additional providers in the county. And so we want more doses to come. I'll be ready to give those out. So even though it's a larger group, I think the challenge is offset by additional doses coming into the county. I think, and I just want people to know that as we're ready to expand our capacity, our partners are ready to expand our capacity. There are some with capacity that we've not been able to give vaccines to just because we don't have enough. So I think there will be even more opportunity to get vaccinated in the county in the next couple of weeks.
Well, I just think it just reinforces the fact that you did all that groundwork so early on, making those relationships with the healthcare systems and the pharmacies. So when we got to the point with all these doses, it would be that system was already set up.
Yes, and thank you for pointing that out. That even from the time that when we were getting like 4,000 doses, there weren't enough to give out. From the time that it went to 8,000 to over 10,000, it was those relationships that we've built over time that say, hey, here's the vaccine, here's the group that we need you to focus on, and that's working pretty well, and that's what we're going to continue to do. I spoke with one of CMOs yesterday of one of our local hospitals here, just talking through again their capacity to expand, and it's really amazing. And the question is not so much about being able to expand, is when do you want us to? Can you assure us that the vaccine will come in? And so and that's good to know. We also know that there are our pharmacists, for example, have such a huge capacity. They've been giving out flu shots for a long time. and they're not doing a lot of that this year. The only thing that's slowing them down is availability of vaccines. So when vaccines come, they will give it out, and that's a huge outlet in our county. So yes, those relationships, understanding from the start that 25, 30, 40 providers are more efficient than one or two locations. That's what we are tapping into, and that's what's going to allow us to be able to handle more vaccines coming to the county.
Okay, great. We have another question that's a little off. It's not so much focused on vaccines, but the question is, and I think this has to do with the fact, this is about our local health order. Are we hearing from businesses who are pushing to remove some of the safety precautions that are in place right now?
Right. So the local public health order, I think it's a conversation that's starting to come up. We've been very clear that having 3 vaccines, potentially a 4th one approved, the AstraZeneca one, it's already being used in other parts of the world, by the way. Actually, there are more than that across the world, but for the United States, we have 3 approved ones. And within a year of dealing with this I don't think you could ask for anything better. We have what is a tremendous tool that's 100% effective against death and hospitalization, and very, very high effectiveness against severe diseases. Those are huge. However, we've been very clear that we got to where we are, not because of the vaccines per se. The vaccines are helping and they're being very impactful. But we changed the trajectory for the better because you are wearing masks, because you are physically distancing, because you sacrificed and avoided what is typically family gatherings of during Thanksgiving and during the holidays. That's why we are where we are. Now, if we get to a point where we have put vaccine in the arms of a lot higher percentage of our population, then we'll be on the same page with you about masks, about physically distancing. I want to get together with people. I want to interact with people. But we have worked so hard to get to where we are, and we don't want to lose the gains that we have made. We need to hang on for a few more months. We're not quite there with the vaccines yet. And so right now we need the vaccines, we need the masks, and we need physical distancing. And our businesses have been critical to this effective response. And so I personally have not had a push from businesses to reverse the order. And if anything else, I've received notes and calls from businesses supporting public health measures, supporting the science behind what we're doing. And I'm very optimistic that that continues. We're not quite there yet. Our rollbacks have to be intentional. It is not a switch on or off. It's got to be looked as a dimmer, and we turn it back as data dictates, as science dictates, so that we don't lose the gains that we have made. It is very, very tough to change the trajectory again if we enter into a new phase where we are allowing this virus to run wild. That would take us a long time, and it will take more resources to arrest and bring back under control. We've done pretty well. We need to stick with it just a little bit longer. I love the President Biden's goal of July 4th. That just means that between now and then, we need to get vaccine into the arms of more people. We need to keep wearing masks. If we do that in the next couple of months, we can have this conversation again as to what do we need to ease. Right now, it's not the time to do that.
Thank you. We have a question from someone on Facebook who took our interest survey, and they just want to kind of know what the next steps are. You know, have you reached out to them? Will you be reaching out? Should they be taking any further action? Maybe just reminding people about the interest survey and how that works, please.
Absolutely. I'll jump in here. I know Dr. Ariel has been in a lot of meetings and talking a whole lot today, so I'll use that. So we do have an interest survey for every phase. So whether you are, 16 and healthy and interested in getting the vaccine, or you have a pre-existing condition, or you work in a Johnson County sector that is considered a critical infrastructure or high priority in one of these phases, we ask that you please go on to jocogov.org/interest survey and fill that out. Again, no matter what your risk category is, if you want the vaccine, if you're interested in receiving it, please fill that out. That is how we will invite people for appointments. And because we are still trying to finish up phase 2 and start working in phase 3 and 4 as we move forward, if you filled out the survey, you may not get an email from us right away inviting you to an appointment. When I checked in with one of my epidemiologists before this meeting, I think we had just under 50,000 responses, and that's just for our this all phase survey. So we do still have some individuals from phase 2 that we're trying to work in. So if you filled it out, you don't need to do anything else for us, but we would certainly recommend that you reach out to the various healthcare partners or the pharmacies that are also offering up appointments for vaccine, and see if you can get a vaccine through one of them before you're able to get one through us. This is an entire public health system. Ourselves, our healthcare partners, our pharmacies, we're all in this together. We're all trying to vaccinate our residents. So if you're interested, certainly come to us, let us know, and maybe you'll get worked in here, but maybe you'll have an opportunity to get it faster at one of our other partners. So look at our website and see what you can find, but certainly fill out our survey and stay tuned and we'll reach out.
Thank you. Another question, there's someone who is interested in registering their employees who are eligible for a vaccination under phase 3 because of the work they do. So in that case, excuse me, what can an employer register employees for a vaccination?
So I think my recommendation would be to go ahead and email jcdhe@jocogov.org. In some situations, if it's a very large employer and depending on the facility, we may be able to vaccinate for our very large warehouses and things like that. Otherwise, we will be able to see about getting you in. But sort of the way is to have that initial contact so we can understand what sector you're in and what number of individuals you're looking to vaccinate.
Okay, thank you. Someone is asking why so much vaccinations or so many vaccines have been sent to rural areas. So is that something that, I know that would be the state of Kansas, but do we have any information on rural versus our county?
Yeah, that's really a question for the state to answer. I would say that it's not something that's unique to Kansas, and I think there are multiple factors there. So other states too, they tend to be more vaccine availability, but even that you have to take in perspective. So in terms of absolute numbers, they're not sending more to the rural counties, but per capita, it appears to be more. And then you have to factor in uptake, the interest, and other things that are factors in there. So so a small community could get 1,000, 2,000 doses, and that's all they need, or even fewer than that. So the larger counties, in terms of absolute numbers, are still getting the most vaccines. But when you compare that to our population, a county of over 600,000 persons, those are the things to see. But I can tell you there'll be different reasons. And it's a question for the state, but it's also not unique to Kansas.
Okay. As we wrap up for the day, are there any closing remarks either one of you would like to make?
We have a new site tomorrow. I think this week and next week, very, very important to show up to the right location. First doses are going to be at the new Lenexa location. Those information are provided to you when you booked your appointment. And so very important so that you show up at the right location and our processes are not disrupted as much. Secondly, is what we've talked about is that we are vaccinating more and more people. However, the work is not finished. There's a lot of work to do. We need to continue to wear our masks. and and physically distance. All of those continue to be very important, and they will be for the next, my opinion, next couple of months, when we're looking at the numbers, when we begin to see increase in the number of persons that are vaccinated, and our numbers remain low, which is why we need to keep wearing the mask. It's an easier decision based on lower community spread and higher level of vaccination to say, hey, we can do this now, or we can do, just like Elizabeth talked about that now, to a certain extent, vaccinated people can interact. That's progress that we're making. But we still have quite a big chunk of our population that are not yet vaccinated. The good thing, though, is residents want the vaccine. So as the vaccine become more available, we are going to be vaccinating more and more people. Last week, we shared that our data is showing that we have vaccinated about 25% of those that are eligible, 16 plus in the population. That's improvement. That number will increase this week and increase even more next week as more vaccines become available. And so in the interim, though, if you don't have an appointment, wear your mask, stay home if you're sick, and just continue to be careful. Thank you.
Great. Thank you so much, Dr. Ariola, Elizabeth, and Allison for being here today. Thanks to those who are watching on Facebook and asking your questions, and we'll continue to answer those for you. Thanks so much for your interest in this topic, and we will see you soon. Have a good rest of your day.